We love helping our patients regain the ability to eat and drink, right? But let's face it, dysphagia management can be a bit scary sometimes. Today, we're shining a light on a silent threat that keeps many SLPs up at night: choking. Hi, I'm Teresa Richard. I've been a medical speech pathologist since 2008. I'm a board-certified specialist in swallowing and swallowing disorders, and I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Author of the best-selling book, So You're Having Trouble Swallowing, and host of the Swallow Your Pride podcast, which has over 5 million downloads. Welcome, I am so glad you are here. Foods that like to play tricks. We've all had that moment. A bite goes down the wrong way, triggering a coughing fit and a momentary panic. For most of us, that's all it is, just a moment. But for our patients with dysphagia, the risk of choking can be an ongoing, serious concern that requires our attention and expertise. Certain foods are more likely to cause choking than others, and understanding these culprits is crucial for patient education and dietary recommendations. Think of large pieces of meat, small bones, or dry food, like those dry crackers that crumble into 1,000 pieces, making it hard to form a cohesive bolus for safe swallowing. Like a kid who learns that his stuffed animal can't be flushed down the toilet, we can be mindful of the foods that can easily become lodged in the airway, obstructing airflow and leading to a choking episode. A friend of mine recently shared a story about a time he was out to dinner. This is how he explained it. I remember a few years ago, I was enjoying a delicious steak dinner with friends, laughing and chatting between bites. I took a bite, and suddenly I felt a piece of meat lodge in my throat. I couldn't breathe, my heart started racing, I tried to cough, but nothing happened. For what felt like an eternity, I struggled to dislodge the steak, my face turning red, my eyes watering. My friends, initially unaware of the severity of the situation, continued their conversation, oblivious to my silent struggle. Finally, with a hard swallow, the meat dislodged and I could breathe again. This is a terrifying experience and makes us acutely aware of the dangers of choking, even for those without dysphagia. It also highlights the importance of being mindful while eating, even in social situations, and the critical role of quick intervention in choking emergencies. While identifying potentially problematic foods is important, it's not the whole solution. After all, choking incidents occur even with modified diets. We can purchase the safest car on the market, but that won't stop us from getting into an accident and getting hurt if we're driving on the wrong side of the road. This highlights the need for a comprehensive approach to dysphagia management that goes beyond simply modifying food textures. We need to consider the individual's swallowing physiology, their cognitive abilities, their environment, and their general risk factors to truly minimize choking risk and promote overall health. Patient preferences are crucial too. Not everyone wants to drive a minivan, and similarly, a modified diet isn't for everyone no matter how safe it is. A comprehensive swallowing evaluation, including an instrumental assessment like a modified barium swallow study or a FEES, is crucial to identify the specific factors contributing to a patient's choking risk. The evaluation can reveal underlying swallowing difficulties, such as weakness in the pharyngeal muscles or delayed swallow initiation, that may increase the likelihood of choking. It can also help determine the appropriate level of dietary modification and identify compensatory strategies and feeding techniques to improve swallowing safety. Relevant conditions and medication mayhem. Sometimes the risk of choking is heightened by underlying medical conditions or medications. Conditions like stroke, Parkinson's disease, or even advanced age can affect the muscles involved in swallowing, making it harder to control the bolus and increase the risk of choking. These conditions can cause weakness, incoordination, or sensory deficits in the oral and pharyngeal muscles, making it more difficult to form a cohesive bolus, propel it through the pharynx, and protect the airway during swallowing. Think of it like squeezing a tube of toothpaste. Normally, you squeeze firmly at the bottom to get a smooth release. But dysphagia would be like giving it a weak squeeze at the top of the tube or squeezing a tube with a hole in it, hoping to see any toothpaste come out at all. Certain medications such as sedatives, antidepressants, and some pain medications can affect alertness, coordination, and reflexes, making it harder to react if a choking incident occurs. It's like trying to drive a car with blurry vision. These medications can impair a person's ability to sense the presence of food or liquid in the airway, trigger a timely cough reflex, or effectively clear the airway if aspiration or choking does occur. Mr. Saez, a 72-year-old woman with a history of stroke, was admitted to the hospital for pneumonia. She had been experiencing increased difficulty with swallowing and had a few recent choking episodes, which left her feeling anxious and apprehensive about eating. The SLP conducted a thorough evaluation, including a modified barium swallow study, which revealed significant weakness in her pharyngeal muscles and delayed swallow initiation. In addition, Mrs. Saez was taking several medications that could potentially be contributing to her swallowing difficulties. The SLP collaborated with the medical team to adjust her medications and provided her with compensatory strategies to improve bolus propulsion, including an effortful swallow with a chin tuck. She also initiated a program of swallowing exercises to strengthen Mrs. Saez's pharyngeal muscles. With these interventions in place, Mrs. Saez's choking episodes decreased significantly, and she was able to enjoy mealtimes with greater confidence. Managing choking risk often requires a team approach. Collaborating with physicians, nurses, pharmacists, dietitians, and other healthcare professionals can help ensure that all aspects of a patient's care are optimized to minimize choking risk. This may involve adjusting medications, modifying dietary textures, providing nutritional support, and addressing any underlying medical conditions that may be contributing to dysphagia. Thanks for coming with me on this exploration of the often overlooked dangers of choking in dysphagia management. Don't forget to hit that like button and subscribe to catch my future videos on dysphagia management and patient safety. And don't forget to share your own experiences and insights in the comment section below. Have you had any close calls with choking in your clinical practice? What strategies do you use to minimize the risk for your patients? Oh, and stick around until the end for an awesome freebie. Oral health, environmental hazards, and the power of supervision. Beyond the food itself and underlying medical conditions, several other factors can contribute to choking risk. Oral health. Good oral health is essential for safe swallowing. Our teeth and dentures help us break down food into manageable pieces, making it easier to form a cohesive bolus and swallow safely. Poor oral health, xerostomia or dry mouth, ill-fitting dentures, or missing teeth can increase the risk of choking. Swallowing with a dry mouth and throat is like going down a water slide without any water. You're going to get stuck. Environmental hazards. The environment in which we eat can also play a role in choking risk. Distractions, such as watching TV or talking while eating, can make it easier to lose focus and accidentally inhale food or liquid. While chewing and swallowing may seem like second nature to you, our patients with dysphagia often need to focus on what they're doing and even utilize multi-step compensatory strategies that can be difficult to recall. But eating alone isn't the best option either. Eating is often social and can bring immense joy to people's lives. Plus, if the person's alone, there may be no one to assist if a choking incident occurs. The power of supervision. Supervision during mealtimes is crucial, especially for patients with dysphagia or those at high risk of choking. A trained caregiver or family member can monitor the patient for signs of choking and provide assistance if needed. Just having someone close by can significantly decrease the chances of choking, and if they are CPR certified, can increase the likelihood of survival if choking does occur. Simon, an 88-year-old gentleman with dementia, was residing in a skilled nursing facility. He had a history of aspiration pneumonia and was on regular solids with nectar-thick liquids. One day during lunchtime, Simon began choking on a large piece of chicken. The certified nursing assistant who was assisting him with his meal immediately recognized the signs of choking. Simon's face was turning red, he was clutching his throat, and he was unable to make a sound. The CNA quickly sprang into action, performing the Heimlich maneuver which she had been trained in for years, but never had to put into use. With a few forceful thrusts, the food dislodged and Simon could breathe again. He was shaken but unharmed, thanks to the quick thinking and training of his caregiver. Choking can happen to anyone, but by being aware of the risk factors and taking simple precautions, you can make mealtime safer and more enjoyable for your patients. Remind your patients to chew carefully, be mindful of their surroundings, and don't be afraid to ask for help if needed. Most importantly, advocate for your patient safety by conducting thorough evaluations, collaborating with the interdisciplinary team, and providing ongoing education and support. Ready to become an absolute dysphagia champion for your patients? Join the Medical SLP Collective. Head over to medslpcollective.com to check us out. We offer a wealth of information, including research-based resources, expert webinars, and peer-reviewed downloadable guides to help you stay at the forefront of dysphagia care. Our online forum provides a supportive community where you can connect with fellow SLPs, share your experiences, and learn from each other. To get you started, check out the link in the description for a free resource reviewing common medical conditions that can result in dysphagia. Enjoy and see you next time.